Hi everyone, and welcome to today's WALPEN webinar. I'm Marcy Hubbs, the manager of Well Ahead Louisiana's Provider Education Network. Thank you so much for joining us today. First, I'd like to go over some general information regarding this webinar. This webinar will be recorded and posted to www.walpen.org following this presentation. An email including the link to this recording and all the materials presented during today's presentation will be sent to all who have registered for this webinar. This email will also include a brief evaluation, so please take the time to provide us feedback to direct future webinars. If you have any issues during this webinar, please type the message in the chat box and we'll do our best to address it. And also, please hold all content-related questions until the end of the webinar. We will have time designated at the end of the presentation for Q&A. And at that time, we'll ask you to type your questions in the chat box and the speaker will address. So now we'll bring you to today's webinar, Preparing for Annual Reporting for Patient-Centered Medical Home. We are pleased to have our speaker today from Target Health, Tricia Chandler. Also, her team members, Dana Hewitt and Lori Myers, will not be speaking today, but will be available for support and technical assistance following the presentation. So Tricia has been a nurse for over 25 years. She has been a recipient of several awards, including the City Business of New Orleans Healthcare Hero Award, and recognized as a Great 100 nurse in Louisiana. She has had a diverse career as an emergency room nurse, quality and performance improvement and risk management coordinator. She has worked as a clinical integration nursing supervisor and currently serves as a healthcare advocate for federally qualified healthcare centers. We're grateful to have her speak and share a wealth of knowledge and experience. So I will now turn it over to Tricia to get us started.
I'd like to thank you for having me today and look forward to the presentation. Welcome everybody. I hope everyone is staying safe during these trying times, especially those that are having to work remotely from home. Certainly understand the challenge there. And thank you for joining me today for this webinar. With that, we'll go ahead and get started. Today's topic is Patient-Centered Medical Home, PCMH, Preparing for Annual Reporting, being presented today by Target Health. What is PCMH? The Patient-Centered Medical Home is a model of care that puts patients at the forefront of care. PCMHs build better relationships between patients and their clinical care teams. Research has shown that PCMHs improve quality and patient experience and increase staff satisfaction while reducing healthcare costs. Practices that earn recognition have made a commitment to continuous quality improvement and a patient-centered approach to care. To become an NCQA recognized patient-centered medical home, a primary care practice learns the NCQA PCMH concepts and required criteria and begins the transformation process. What are the recognition stages? There's three main components. One is to commit, the second is to transform, and the third is to succeed. And we're going to go into depth on each one of those. Commitment is the enrollment process. This is where your practice learns the NCQA PCMH concepts and begins to apply them. Once your practice knows the concepts and has begun transforming into a PCMH, it enrolls in the recognition program through the NCQA QPAS at qpas.ncqa.org. The second part is transforming. This is your recognition process. The practice gradually transforms building on its own successes while working towards recognition. It demonstrates progress by submitting data and evidence for NCQA evaluation using QPAS and completing up to 3 virtual reviews with an assigned NCQA evaluator. And finally, success. This is where your annual reporting occurs. The practice continues to implement and enhance the PCMH model to meet the needs of its patients. Each year, the practice demonstrates to NCQA that its ongoing activities are consistent with the PCMH model and recognition standards. The annual check-in includes attesting to certain policies and procedures and submitting required data or evidence. Quality Performance Assessment Support System, otherwise known as QPAS. QPAS includes a series of dashboards to manage organizations and programs. Once an organization account is created, one or more affiliated sites can be enrolled in the NCQA PCMH recognition program. The QPAS website is displayed below. You'll see the 6 widgets here, which goes over how to sign in and enroll, determining who's eligible. They have their contact information on here as well, learning about different programs that is offered, pricing, and always educational resources. Navigating QPAS. In order to access QPAS, all users must sign a license agreement. A user's email address is their account login identification for QPAS. Both an organization and any individuals working on its behalf must set up accounts in QPAS. A user working with multiple organizations can view all organization and program dashboards from one login. This is the login screen that you will see when you go to the QPAS website. You'll enter your email address and your password to sign in. Once you sign in for the first time, you'll have an acknowledgement that you will have to attest to. So you'll click on the accept and sign and continue. Once you log in, one of the real nice features of QPAS is the notice for what's new. This is where they give you information on new features and updates. And also, as you scroll down, you'll see all of the historical updates to this area as well. Navigating the NCQA application platform. Steps for enrolling in QPAS. There are 6 steps. The first step is you're going to add your practice sites. The second step is adding the recognition program for which you want to be recognized. That is followed by setting up your clinicians, signing legal agreements, generating your invoice and pay, and then reviewing your information to complete the enrollment. A must-see for new users is addressed below. This is navigating through QPAS, which is a video tutorial that was published in February of 2019, which will provide you with a step-for-step how to navigate the application platform for QPAS. I found this video to be very helpful. After logging in, you'll select your organizational designation. And if you don't have one, you can create or claim your organization from the link that is in the upper right-hand corner. Users will set up practice sites and multi-site groups and provide information on the clinicians associated with each site. The multi-site application process is an option for organizations or medical groups with 3 or more practice sites that share an electronic record system and standardized policies and procedures across all practice sites. These clinicians determine the practice's program cost. The enrollment checklist, organizational information that is required, is the legal entity business name. You'll need the address, city, state, and zip, who the primary and secondary contact names along with their email addresses, the locations of the practices, and the list of the specialties. The tax ID number and NPI, if it's available, also will be needed for each practice site. You'll need the full name, date of birth, specialty, board certification, and the NPI numbers of the clinicians at each practice. The disclosure of representative from the organization that has legal authority to sign business agreements with NCQA will also need to be completed. And then the method of payment for your fees via credit card or check. Qualifying clinicians. Clinicians who hold a current unrestricted license as a doctor of medicine, a doctor of osteopathy, advanced practice registered nurse, or physician assistant. Only clinicians who can be selected by a patient or family as a personal clinician are eligible to be listed. Non-primary care specialty clinicians and APRNs and PAs who do not have a panel do not qualify. This would also include residents. The fees associated are below. A single site applies to practices applying for the first time that do not qualify for multi-site pricing. Practices pay the annual reporting fee during their annual reporting. Multi-site applies to practices applying for the first time. These practices pay the annual reporting fee during the annual check-in. They have 3 or more practice sites operating under the same legal entity. They share an EHR system and have standardized policies and procedures across all sites. Discounted partners in quality pricing applies to single or multi-site practices applying for the first time that provide an assigned discount code from a qualifying initiative. Listed out the pricing examples for each type. For single site pricing, it's according to the number of clinicians, and the initial recognition fees and the annual reporting fees associated are listed here as well. So for example, an organization that has one site, a single practice site with 16 clinicians. This is the breakdown for the initial recognition fee. Site A with 16 clinicians and the cost for clinicians 1 to 2 at $800 each would come to $1,600. The cost for clinicians 3 to 12 at $475 each is $4,750. The cost for clinicians 13 and up are $55 each, and the price is $220. So the total in this example is $6,570. So the organization pays $6,200 for its initial recognition fee. This is the list of the annual reporting fee that you can see broken out as well. And this organization above would pay $1,922 a year during its annual reporting period. Multi-site pricing is listed here as well. So if you have 1 to 12 clinicians, the initial recognition fee is listed as $255, and then the annual reporting fee of $155. For 13 plus clinicians, the initial recognition fee is $30 with an annual reporting fee of $1,550, plus the multi-site fee, which is $1,600. I've included this example as well that will provide some context as to how the pricing is applied. This is an example of if an organization has 2 practice sites. Site A has 14 clinicians, and Site B has 6 clinicians. Site C has 16 clinicians, and the breakdown for each of those are listed here. The organization pays $9,430 for its initial recognition fee. This also is their annual reporting fee breakdown. So based on the number of clinicians, the organization pays $4,473 each year during its annual reporting period. There's a cost for extra virtual review. So for sites that have not achieved recognition after their 3rd check-in or have not completed recognition within the 12-month allotted time frame can purchase an extra virtual review. The pricing for the extra review is 50% of the initial per clinician fee paid by the entity. Fees apply to each clinician associated with the entity's recognition, and those also are listed below. What to expect once you're enrolled. NCQA assigns an NCQA representative to a practice after the legal agreements are signed electronically and payment is submitted through QPass and received by the NCQA. The NCQA representative helps the practice coordinate its schedule and navigate resources and is the liaison between the practice and the NCQA. The representative schedules an initial introductory call with the practice to discuss the virtual check-in process and resources to create an initial PCMH transformation plan. This is a recommended pathway through the PCMH requirements. This representative also suggests applicable education and training. Key components. Concepts, criteria, and competencies. There are 6 concepts. To earn recognition, a practice must complete criteria in each concept area. If you're familiar with past iterations of the NCQA PCMH recognition, the concepts are equivalent to standards. The underlying the 6 concepts are criteria. Activities for which a practice must demonstrate satisfactory performance to obtain NCQA PCMH recognition. Criteria are developed from evidence-based guidelines and best practices. A practice must pass all 40 core criteria and at least 25 credits of elective criteria across the concept areas. Competencies categorize the criteria and do not offer credit. So what this visual is showing is the breakdown of each one of those components. It's showing you the concept, which is a brief title describing the criteria and uses a 2-letter abbreviation at the end. The competency is a brief description of the criteria subgroup organized within the broader concept. Criteria is a brief statement highlighting the PCMH requirements. All of the criteria are numbered consecutively within their respective concept. Criteria are also labeled with their scoring designations. So a core criteria is listed here in this example. The intent is a brief statement describing the concept goals and the intent. You have also listed the evidence that's required. This is the proof that a practice meets the criteria and can be demonstrated by submitting documentation such as policies and procedures, examples, data, or reports, and through a virtual review of a practice's systems and electronic capabilities. The icon that you see in the bottom indicates that evidence is shareable across the practice sites. This is the 6 primary concepts: team-based care and practice organization, with the abbreviation of TC. This concept helps structure a practice's leadership, care team responsibilities, and shows how the practice partners with patients, families, and caregivers. Knowing and managing your patients, or KM, sets the standards for data collection, medication reconciliation, evidence-based clinical decision support, and other activities. Patient-centered access and continuity, AC, guides practices to provide patients with convenient access to clinical advice and helps ensure the continuity of care. Care management and support, CM, helps clinicians set up care management protocols to identify patients who need more closely managed care. Care coordination and care transitions, CC, ensures that primary and specialty care clinicians are effectively sharing information and managing patient referrals to minimize cost, confusion, and inappropriate care. Performance measurement and quality improvement, QI, is improvement helps practices develop ways to measure performance, set goals, and develop activities that will improve performance. There are 2 types of criteria, core versus elective. Of the 101 criteria in PCMH, 40 are core and 61 are electives. A core criteria must be completed by all practices seeking recognition. An elective criteria is a selection of additional criteria a practice may choose from to indicate that it's functioning as a medical home. Electives will be noted with their credit value. Practices must select elective criteria from at least 5 of the 6 program concepts that we just reviewed. The core criteria are listed here and are further separated by review and attestation. It also shows on this slide the elective credits that are offered for each one of the criteria. These are the criteria that have 1 credit, 2 credits, and 3 credits associated. Annual reporting. What is annual reporting? NCQA's redesigned PCMH recognition program lets practices maintain their recognition status through an annual reporting, which replaces the previous 3-year recognition cycle. Rather than coordinating and submitting many documents for evaluation all at once, practices may present evidence of inflammation in other ways and tell the story of the PCMH transformation. Your practice will demonstrate that it continues to embrace continuous performance measurement and monitoring by submitting evidence across 6 different concepts and a special topic by answering a few multiple choice questions, entering data into QPAS, for example, the numerators, denominators, or short answer responses, uploading report and evidence to demonstrate quality improvement and patient experience, confirming practice information, entering clinician changes, if any, and paying the annual fee. If the NCQA determines that your practice meets requirements, your recognition continues for another year. Simplified annual reporting now requires less documentation. It's designed to reduce the effort needed to show the NCQA that you are still functioning as a medical home. Your practice will not have to provide evidence for every requirement, upload documented processes, provide a report to support every numerator and denominator question, run new reports to fulfill data range minimums. Reporting dates are now flexible, or take screenshots for evidence of implementation. If your practice achieved PCMH recognition in 2014 at level 1 or 2, recognition at an accelerated pace can be earned. Practices will be able to attest to meeting certain criteria without providing the evidence required of practices seeking recognition for the first time. Examples of evidence that prove that a practice is continuing to function as a PCMH include attestation, and this is done in QPAS, data entered into QPAS, again, numerator, denominator, the reporting period, examples, descriptions, documents, explanations, tools the practice uses to meet requirements, example, the patient screening tools, QI worksheet to demonstrate quality improvement activities, and reports, aggregated data, or EHR system-generated reports. A tip is that attestation questions are designed to save you time. Checking a box or a simple numerical yes or no answer is enough for questions that require attestation. There's no need to spend time pulling reports or other documentation. Evaluation course. Each practice or multi-site group will have up to 3 check-ins, including a virtual review process that must be completed in a 12-month period. Timing of each check-in is flexible and determined by the practice. The NCQA representative monitors your progress over the course of the 12-month period. Practices that exceed this period or that need additional check-ins to achieve recognition must pay an additional fee. Practices may only purchase 1 additional virtual review session or receive 1 90-day extension. A check-in is conducted virtually online with an NCQA evaluator who evaluates the practice's progress and provides immediate, personalized feedback. For continuity of review, practices continue with the same evaluator for each check-in. This graph here shows annual reporting versus earning your versus earning initial recognition. He goes over the number of requirements for earning initial recognition and the PCMH annual reporting requirements. It also shows you what the NCQA wants to see, what those reporting processes are, and the document review process. Duration of recognition. The practice is recognized until its next anniversary date, which is based on 12 months from the recognition decision. Recognition status does not require renewal, but continues indefinitely, contingent upon the continued adherence to the program standards, submission of annual reporting requirements, and the annual reporting fees. The good news. If your practice is functioning as a PCMH and can meet the annual reporting requirements, the process should take from 15 to 30 hours or less of work per year over several months to complete. 2020 Annual Reporting Requirements Checklist. This checklist will demonstrate each one of the criteria and the components that must be reported and what the task is. And I've included these in this presentation for your reference. It goes through all 6 of the concepts and also includes the special topics. Annual reporting dates. Annual reporting requirements are released every July for the following year's reporting period. Your practice will use the annual reporting requirements based on its reporting date, not its anniversary date. Those publications are listed below. In July of 2020, they released the annual reporting date, publication, reporting period, January through December of 2021. Your practice's annual reporting date is 1 month prior to your recognition anniversary date. All annual reporting data and evidence must be submitted by your annual reporting date. For example, if your anniversary date is March the 15th, your annual reporting date, the date when all annual reporting documentation must be submitted, is February the 15th. Practices that are a part of a multi-site organization share the same annual reporting date, unless it is otherwise requested. The annual reporting date is the date when the first practice site earned recognition. When you pass annual reporting, your PCMH recognition will be extended for another year. Major milestones and tasks for annual reporting checklist. The milestone, this is a generalized milestone and task spreadsheet here, and shows what time before your annual reporting date that these things need to be accomplished. So you would want to download the annual reporting requirements at ncqa.org the July prior to the reporting year. That's when those are available. You want to review the requirements, use the annual reporting requirements checklist with the PCMH work group, review the task and evidence required for each criterion, and review practice processes and policies. This should occur 6 months. before your annual reporting date. For the plan section, you want to identify the staff to work on annual reporting, decide who will gather and run the reports, determine which processes may need to be modified, and develop a plan to collect data and assess workflows. This is 4 to 6 months. Assess. You need to run baseline reports to check your performance and compliance, identify which annual reporting options to pursue, determine areas that need further evaluation and work, identify workflows that need to be updated and or adjusted, apply improvement strategies, run new reports, and determine if any additional reports are needed. This also is 4 to 6 months. Monitor. You want to continue audits and monitoring of reports, review each requirement to determine what still needs to be completed. Again, the time frame for that is 4 to 6 months. 3 months, within 3 months of your enrollment, you need to log into QPAS, enroll your sites, update your site and clinician information. In 1 to 2 months, you want to answer the annual Get to Know Your Practice questionnaire. You want to test to the current PCMH program requirements, finalize all remaining evidence and reports, upload final evidence and data, and within that 1 to 2 months, you need to pay the fee and submit the annual report evaluation. To maintain recognition, NCQA reviews your submission and notifies your practice that you've maintained recognition. There's also a practice gap assessment and improvement checklist, which is used to help your practice determine areas for improvement. Use these checklists as a staff activity to assess how well you're maintaining the PCMH culture. The checklist will also help you determine how you can use the annual reporting requirements to make improvements that align with your practice goals. This checklist can be found at ncqa.org. The benefits of PCMH recognition. There's payer support, partners, and quality. Because NCQA PCMH recognition is associated with lower cost and better quality, many payers offer financial support, coaching, and technical assistance, or physician tiering for practices that earn NCQA PCMH recognition. Many payers' value-based contracts also incorporate NCQA PCMH recognition as part of their incentive programs. Health plans, medical associations, clinically integrated networks, and states are just some of the organizations that provide qualifying financial incentives or transformation support services to practices seeking NCQA recognition at no cost to the practice. Providers achieving NCQA recognition also receive maintenance of certification credits from the American Board of Family Medicine, the American Board of Internal Medicine, the American Board of Pediatrics, and the American Board of Physical Medicine and Rehabilitation. Does anyone have any questions?
Thank you so much for sharing this information with us today. So we will take time now to take any questions. If you do have any questions, please enter those in the chat box and then the speaker can address. I don't see any questions coming in, so if we miss getting any questions, or if you think of questions after the presentation closes, please follow up with our speakers and they'll be glad to assist you. I think they have email address, Trisha's email address to share, and you can reach out to Trisha or any of her team members for answers on PCMH or the reporting that she discussed. And as a reminder, we will follow up with an email that will include the materials covered today and also a link to the recording of today's webinar. Anything else, Trisha, you'd like to add?
No, thank you very much for the opportunity.
We appreciate it. Thank you.
Thank you.
All right, so thank you all for joining us today. Look out for your next Walpen newsletter for updates on upcoming trainings, available resources, and other opportunities. Until next time, thanks.